All right, Doc, I got one that I get called on all the time. Do you treat athletes on anything except for football?
You wouldn't think so in Texas in the fall. So in the fall, mostly football. No, we treat every sport. And, nowadays is different than it was 20 and 30 years ago. We treat a lot of lacrosse injuries. We treat women's field hockey injuries. Yes, there's starting to be esport injuries out there, which I can tell you that my parents probably don't get esports still, and what I mean by that. But we treat every injury for every sport. You will have, and it's a lot of fun. You will have a 40-year-old who was riding a skateboard with his kids because he used to ride a skateboard a lot growing up. And he had an accident. More likely to come in are his kids, not the 40-year-old.
Sure.
But you name the sport, and we treat it. And I get asked a lot. Okay, so why aren't you a surgeon? Part of the fun of my specialty is getting people better without surgery, but it allows me to see all these sports.
Right.
And I've been fortunate in all the years in practice. A lot of our group is that a lot of people feel comfortable coming to us, regardless if it's a football or a skateboard. Just because we've treated these injuries over time. We do not have the attitude of, hey, what are you doing? You need to just stop doing that, regardless if you're a 12-year-old playing football or a 40-year-old riding a skateboard. And so, I've always thought that we try to keep people active, regardless of whether you wear a uniform or not. And that's important. And I think patients appreciate that because if you're someone that is older, and you live by yourself, you need to stay active just to be able to take care of yourself.
Yeah,
and so that's the most important one.
Kids in this community that function in this community, so by default we end up becoming the team physicians for wherever our kids are.
Yes, sir.
I mean, for me, it's as simple as my daughter in cheerleading, and you get phone calls about that, or my son playing a sport, your son's playing sports. I'm sure you get all the time. It's like, hey, I've got, by the way, my kid fell and broke this or injured this, or getting him in. But that's not just for our families, and we do that for the entire community. So regardless of what sport, regardless of what athletic, whatever life event, we really treat pretty much all of it in the musculoskeletal category, and that's where we shine.
And I think that's why we all love what we do.
Oh, absolutely.